Good afternoon, and thank you for joining us today. I'm Linda Czipo, President and CEO of the Center for Nonprofits, New Jersey's statewide umbrella organization for the charitable nonprofit community. On behalf of today's speakers and New Jersey's 34,000 charitable nonprofit organizations serving communities across our state, welcome to today's press briefing, hosted by the Center and the Council of New Jersey Grantmakers. We're here today to urge our policymakers in Washington and Trenton to enact urgently needed COVID-19 relief for our residents, and so that nonprofits can continue to meet the growing needs of our communities through the crisis and beyond. Throughout this emergency, as with countless other crises, New Jersey's nonprofits have been a lifeline and a backbone, providing life-saving care, food, shelter, mental health counseling, job training, education, forums for artistic and spiritual comfort, healing and inspiration, environmental stewardship, and an outlet for collective action and social change. As employers of 10% of the state's private workforce and consumers of goods and services, New Jersey's 34,000 nonprofits are also vital to the economy. The COVID-19 pandemic has had a devastating impact on our state's nonprofits at a time when New Jerseyans need them most. Nearly all nonprofits are experiencing significant or moderate disruptions to their programs, from skyrocketing demands for services and escalating expenses to canceled programming and events and reduced income from donations and other sources. In a July survey conducted by the Center for Nonprofits and the Council of New Jersey Grantmakers, more than 25% of our respondents had reduced staff, representing over 13,000 lost positions in 80 organizations alone, and almost 60% had lost more than $193 million as a result of the crisis. If you extrapolate these figures across the entire charitable sector, the impact is staggering. Nationwide, Johns Hopkins University estimates that nonprofits' jobs are down nearly 1 million as of August 31st, compared with pre-COVID February of this year. And some analyses suggest that the pandemic could force 22,000 or more organizations to close their doors permanently as a result of the crisis. For people in many communities, a nonprofit is the first, last, or only source of help. And when a nonprofit closes, vital services are lost and many are left with nowhere to turn. Our leaders in Washington and New Jersey have enacted a number of critical measures that have provided vital assistance over the past several months. But we also know that there are gaps, and we also know that given the scope, magnitude, and duration of this crisis, more is desperately needed, and it's needed immediately. Nonprofits have been joining together to ask for a series of common public policies that would help to address some of these critical needs. They include, but are not limited to, additional funding, including additional federal aid to state and local governments, and additional federal and state funding to help charities meet increased demands, retain employees, address rising expenses, purchase desperately needed PPE, disinfecting supplies, and meet many other needs. The Federal CARES Act, the Paycheck Protection Program, and other grants and loans that have been enacted have been critically important, but with that money having run out and no end to the crisis in sight, much more is needed. Programs will also need to be expanded so that nonprofits that were previously ineligible will be able to apply. We also need to strengthen incentives for charitable giving. Nationwide, charitable giving was down by 6% in the first quarter of 2020 compared with the same period a year ago, and that was before the worst of the pandemic began to hit. Passing federal and state legislation to provide incentives for people to give to charity, regardless of their federal itemizing status, would help to provide a desperately needed lifeline for these essential organizations. We also need to help nonprofit employers. As we just heard, many nonprofits have laid off or furloughed employees because of the pandemic, and more job losses are undoubtedly forthcoming. These reductions compromise program continuity and effectiveness, and they can also result in dramatic increases in unemployment expenses. So we need to pass legislation to ensure that the layoffs and separations precipitated by this crisis don't adversely affect the experience ratings of contributing employers, and that for those nonprofits that get reimbursed, that reimburse the state system, that they are made whole, that Federal CARES Act provides 50% reimbursement for those expenses, but that's still leaving those organizations with an extremely large bill, and we need to provide, to pass legislation to provide funding for the extra 50%. We also need more flexibility in terms of government contracts, allowing nonprofits to modify those contracts with state and local governments if they're not able to fulfill the original terms because of the pandemic. And we also need to provide regulatory and filing relief for nonprofits, providing extensions for filing corporate reports and charities registration reports, and raising the audit threshold for charities registration. Those are just a few of many, many suggestions and recommendations and requests that have been put forth by the charitable community. These are common to a wide array of nonprofits. We know that additional aid within different fields are desperately needed, and you're going to hear from some representatives in just a moment. But right now, it's a pivotal time. We need our policymakers in Trenton and in Washington to come together on a bipartisan basis and put forth solutions and do it without delay. Today's speakers are going to talk about how the pandemic is affecting their communities and organizations, how they've been stepping up during the crisis, and how policy proposals among those that we've put forth, or perhaps others, would help, and what else is needed. And after that, we will be able to answer reporters' questions. First up, I'd like to introduce Maria Vizcarrondo, President and CEO of the Council of New Jersey Grantmakers. Maria?
Thank you. Thank you, Linda. I'm pleased to be here with you and with this group of incredible nonprofit leaders. The Council of New Jersey Grantmakers is a nonprofit member organization for New Jersey's philanthropic community. Our members include private, corporate, family foundations. I am proud of how philanthropy in our state is working hand in hand with their nonprofit partners and making every effort to deal with this particular pandemic. Many have increased their grant making during this time, provided new emergency funding, and many have even eliminated restrictions on current grants. A number of foundations, over 15 foundations, have helped to create special rapid response funds to meet the needs of the community during this coronavirus. Again, I am very proud of the work that our members have offered to our nonprofit partners during this time period. However, even with all that, philanthropy can never fill the gap left by government. The COVID-19 crisis has created an alarming financial, and programmatic impact on the nonprofits that people and communities rely on every day to meet their needs. Most have had to cancel programs and events, which has cost much in revenue losses for many of our nonprofit partners. Many have had to even reduce the number of staff and volunteers that they have. And this is at a critical time when our communities and our nonprofits need to work hand in hand to meet the front line to meet the needs of our communities. For all good work that philanthropy accomplishes in New Jersey, it can never replace government funding. Its role is to leverage the investment of government and business to improve the quality of life for our residents. This partnership is more important now than ever and can only happen if there's that kind of collaboration and support. The Federal CARES Act was a lifeline to nonprofits and ensured that philanthropy could leverage their grant making in response to COVID-19. The state has taken some important initial steps including grant and loan programs to nonprofits, but this doesn't go far enough. Make no mistake about it. The pandemic is causing serious problems for New Jersey's nonprofits, which are the backbone of our communities. It's like firefighters trying to do their job while their firehouse is ablaze. And now, after 8 months, the firehouse is still burning. Philanthropy and the nonprofit sector stand side by side in good times and in bad. We are devoted to our communities. We all want to get this pandemic out of the way and to help New Jersey become stronger and, very importantly, more equitable than ever before. This pandemic is causing unprecedented human and economic devastation and uncovering a level of systemic racism that demands our attention. As long as it takes, New Jersey's philanthropic sector will be on the front lines helping the helpers, the tireless New Jersey nonprofits that provide so much for so many, even at a time when they are being battered. But philanthropy cannot serve this role alone. Government, both federal and state, must ensure that nonprofits can continue to serve people fighting to stay afloat during this raging pandemic.
Thank you, Maria. Philanthropy has been absolutely phenomenal in New Jersey in terms of stepping up. But as you said, this is the sheer magnitude of what we are facing means nobody can do it alone. But we thank you for and your members for everything that they're doing. Now we're going to turn to Karen Andrade-Mims, the Executive Director of the Father Center. Karen?
Good afternoon, everyone. And Linda, thank you so much for inviting me to be a part of this press conference today. As Linda said, I'm the Executive Director of the Father Center of New Jersey, which was once called Union Industrial Home for Destitute Children of Trenton. We were established as an orphanage in 1859 and, in fact, are the oldest child welfare agency in New Jersey. We've evolved over the years, changing with the times and the needs of the community. Today, we strengthen families by strengthening fathers. We believe child well-being is directly tied to responsible fatherhood and a father's ability to achieve self-sufficiency. Last year, and certainly prior to the pandemic, we served over 1,500 men between our two offices in Mercer and Burlington counties. The core of what we do is focused on job training and workforce development. Our signature program, Bridges to Success, has served over 500 men to date by helping them earn certifications in key industries, such as Serve Safe Food Handler, New Jersey Forklift Operator, OSHA 10-Hour Industry, Flagger, and many more. 73% of our participants gained employment and increased their hourly wages as a result of earning these certifications. The average rate of pay begins at almost $13 an hour. In March of this year, we closed our offices due to the pandemic. This resulted not only in the loss of face-to-face contact with our clients, but as we all know, the devastation of our economy. Many of the men we serve are already dealing with multiple barriers to obtaining gainful employment. So this pandemic gave rise to all of those challenges and so many more. Additionally, some of our funders were either forced to cut funding or eliminate it completely. Currently, our Work First New Jersey funding in both Burlington and Mercer counties is on hold. This impacts the jobs of 2 staff members directly, along with 125 men we serve annually in this program. Relief to date has been essential, but it's not enough. We need further relief, and we need it now. Federal aid to state and local governments is critical as we are reliant, for example, on the State Department of Labor to fund our workforce development activities. We also rely on donations from individuals, which is most essential because these are very often unrestricted dollars. We need New Jersey to pass legislation to establish a state-level income tax deduction for charitable donations to nonprofits during this COVID-19 pandemic. Individual charitable gifts are a major part of helping us maintain the safety net for our fathers and families. Furthermore, we need government contracts to be flexible with modifications that may be needed at this time because we struggle to meet our levels of service and we're trying to avoid staff layoffs. Coronavirus relief measures for nonprofits are vital to the ongoing provision of our necessary services and programs. We cannot be an afterthought. The lifeblood of the communities depend on our support. Thank you.
Thank you, Karen. Next, we're going to hear from Anne Marie Miller, Director of Advocacy and Public Policy for ArtPride, New Jersey.
Good afternoon, everybody. Thank you, Linda, and for this opportunity. And ArtPride New Jersey is a proud member of the Center for Nonprofits. We are the state's arts advocacy organization that promotes the arts around the state and also emphasizes its public value. The arts in New Jersey were among the very first to close and nearly now among the last to reopen. When healthy, our industry is the $662 million a year industry based on the spending of arts organizations and patrons that attend arts events, and that number is about 8.5 million folks served each year. Due to the pandemic, the estimated loss for a 90-day period was $30 million. So it's reasonable to assume that that has jumped to about $60 million, although we're assessing that right now to get a more accurate data. And that is due to closures, to cancellations, to staff reductions, furloughs, et cetera. This information about the industry when healthy is available at keepjerseyartsalive.org, where you can also drill down and find out the value of the arts industry in your county. So you will get individual information on county, more local data as well. There's also a video there of how the arts have really helped with healing and public health during the COVID crisis. Doing everything from helping deliver meals to making PPE and offering virtual programming for students and adults. The state received through the National Endowment for the Arts and the CARES bill that was mentioned before, $495,000 for the entire state of New Jersey for the arts organizations. So we are very supportive of additional funding for the National Endowment for the Arts, for PPP, and for the Save Our Stages bill, which will benefit performing arts centers that are both nonprofit and for-profit. The additional support is essential. I don't think there's any more that can be said. State and federal funding relief is essential. There are problems now actually with rehiring people in the arts industry because they won't, it's difficult to take a short-term position and then place yourself back in the unemployment system when that happens. So folks are having problems rehiring right now. We are also under an executive order that allows up to 150 people in indoor venues, but many of the venues are not prepared with the sufficient PPE that's essential to make sure that the audiences feel comfortable in performing arts venues. Please go to keepjerseyartsalive.org. There's a lot of the statistical information as well as videos that illustrate the value of the arts to our sector in so many different ways, not only for entertainment value, but for education, to healthcare, to community and economic development. Thank you.
Thank you, Anne Marie. Next, we're going to hear from Lorraine Goodman and Graciela Leal from the Latin American Legal Defense and Education Fund.
Great. Thank you. Thank you, Linda. And thank you for inviting us to speak. The Latin American Legal Defense and Education Fund was founded in 2004. Our mission is to promote the rights of all immigrants, facilitate access to healthcare, education, and legal representation, advocate for the integration of immigrants, and foster intercultural communication that strengthens our communities.
El Fondo Latinoamericano de Educación Latinoamericana fue fundada en el 2005. Nosotros tenemos primero la educación y la ayuda para todo inmigrante en los Estados Unidos en el área de Trenton.
While all immigrants struggle to adjust to life in their new country, some immigrants struggle more than others. In Mercer County, where most of the immigrants are from Latin America, that struggle includes learning a new language, navigating the incredible complex path to legal status, and finding some semblance of job security while also understanding local norms and customs.
Mientras todos los inmigrantes tienen sus propias formas de estar en este país y tienen muy pocos recursos, nosotros tratamos de darles sus guías en un nuevo América, en los Estados Unidos especialmente.
The advent of COVID-19 has both exacerbated and exposed the struggles of this community. Jobs at local universities that supported student activities have disappeared. Work at restaurants, cleaning homes, or provided childcare. Jobs that do not provide unemployment insurance, sick pay, health insurance, they're gone.
El venir de COVID-19 ha expuesto a nuestros inmigrantes en el área de Trenton a luchar por poder tener trabajo, por tener educación, por poder tener el cuidado de niños. Algo que era difícil antes de COVID, pero ahora es un poco más la lucha.
Those who can find employment oftentimes work at jobs that place them at a higher risk for contracting the virus.
Todos ellos que pueden encontrar el trabajo durante esa época, durante esta pandemia, muchas veces los ponen en riesgo a contractar el COVID-19.
And yet, these are our essential workers. They pay local and federal taxes, but they're excluded from all COVID-related federal protections,
Y aún
including the CARES Act.
Y aún ellos son nuestros trabajadores esenciales. Pero esos trabajadores son los que se les excluye todo poder de ayuda. No tienen el derecho de dineros federales, no tienen derecho de seguro médico, no tienen derecho de muchas otras cosas que en total se usan para la persona regular.
Without Social Security numbers, they may even have difficulty documenting their income or proving that they are a resident of New Jersey, which can cause problems when they go to the hospital.
Sin un número de seguro social, ellos no pueden ser documentados en formas no pueden tener recursos médicos, no pueden ir al hospital a que les den la ayuda médica necesaria como si fuera alguna persona asegurada.
In response to both COVID-related restrictions and our clients' needs, LALDEF has made a number of changes.
Al respuesto de LALDEF, nosotros hemos tratado de cambiar un poco y tratar de ayudar a la comunidad. Continue.
Yeah. We are currently waiving or deferring legal consultation fees with the understanding that our clients cannot afford even the most basic needs.
En estos momentos estamos tratando de dar los servicios legales, la ayuda legal que nosotros podemos dar, gratis, sin fondo, en tratar de poder dar un poquito más hacia la comunidad.
We have moved some of our adult education classes online with the understanding that some of our most loyal education students cannot access the classes because even if they have a computer at home, they don't have internet or they don't have webcams.
También hemos movido las clases de ESL o de inglés a una plataforma de internet o web. También con el entendimiento que ellos, aunque tengan un teléfono o una computadora, no tienen el acceso del internet.
We have compensated for the closure of our office with live chats on our website. But again, this requires technological ability and access.
También hemos movido muchas de nuestras plataformas hacia el internet, y con chats en vivo durante las horas de trabajo. Pero otra vez, eso se necesita, el poder tener acceso al internet.
So relief that we've gotten to date has been essential, but not enough. For example, Mercer County is blessed to have many organizations, churches, anonymous donors who have reached out to support the local immigrant communities to help alleviate hunger. But our clients have accumulated enough debt that goes beyond food insecurity.
Al día, el poco de ayuda que nos han dado es esencial, pero no es suficiente. Por ejemplo, en el condado de Mercer es bendecido de tener tantas organizaciones, iglesias y donantes anónimos que han dado soporte a nuestros inmigrantes integrantes. En nuestra comunidad han podido aliviar el hambre, han podido aliviar un poco de deuda hacia nuestros clientes y un poco más en la seguridad de la comunidad.
Landlords are threatening eviction, even though there's a moratorium, because they know their tenants won't go to the authorities.
Hay muchos de ellos que tienen hogares y casas han tratado de decirles a los tenentes que pueden estar evictados, que los pueden sacar de su casa. Y aún teniendo un bill para ser fuera de la ley. Pero ellos saben que muchos de ellos no van a ir a sus autoridades, no van a pedir la ayuda.
Our students don't have internet access. They don't have computers. So they don't have the technology to keep up for virtual classrooms. So a couple of ways that the government can help. One way clearly is greater funding, but also creating more internet hotspots in inner city communities that are not only accessible, but safe.
Nuestros estudiantes no tienen acceso al internet. Una forma que el gobierno puede ayudarnos es creando más espacios en el aire o hotspots, como se dicen, a las comunidades que no tienen sus recursos, miembros de recursos fondos bajos.
LALDEF provides municipal ID cards, which are accepted by some local hospitals as proof of residency, but we need that expanded so that more places will accept the ID cards as photo ID.
Una forma que LALDEF ayuda es con los IDs municipales o identificaciones municipales. Muchos hospitales los aceptan como prueba de residencia o como prueba de carnet. Para poder tener más aceptancia, se pueden abrir más locales donde se puedan ayudar.
I could go on also about the medical care that many of our clients are not they can't access, because they can't get insurance, because they can't prove their residency. I mean, there are just so many needs. It's quite overwhelming. Our staff does what we can for a budget, with a budget of under $650,000.
Yo puedo continuar con la necesidad que Walter trata de ayudar en solamente proveer el potencial de tener ayuda médica. Nosotros tenemos una fianza pequeña de $6,000, no pude decir, perdón, $6,500 en estos momentos, y aún así no es suficiente.
So we need additional help to help our families.
Y al fin se necesita más ayuda para poder ayudar a nuestras familias.
Thank you.
Gracias.
Thank you, Lorraine and Graciela. And thank you to Anne Marie, Karen, Maria, for sharing your perspectives today. The stories you have heard are just a tiny fraction of what's going on in our communities throughout New Jersey, throughout the country. And the help that's needed is needed immediately. Lives are on the line, and nonprofits are probably, in many cases, the difference between being able to sustain through this crisis and not. We know that our elected officials have been facing a monumental task as they try to lead us through this crisis. New Jerseyans are counting on nonprofits to be there with immediate and long-term programs and services to help us through the current crisis and through long-term recovery. We also know that past experience has shown that when disaster strikes, and whether you're talking about an economic downturn or a pandemic, it's the nonprofit community that gets hit first, and it's the nonprofit community that recovers last. We can't afford to let that happen. Too many people are counting on us. So we urge lawmakers in Trenton and Washington to enact additional relief without delay. This kind of help cannot wait. We'd be happy to open things up to questions now. And if you are a member of the media, as I mentioned before, please identify yourself in the chat box and we can unmute you so that you can ask questions. There is a question in the chat. I don't believe this is a member of the media, but it's certainly a pertinent question that has to do with the status of legislation S2360, A4183, which would allow income tax deductions for charitable contributions to New Jersey charities during the pandemic and for a short time afterward. This legislation passed the Senate earlier this year. Both of these bills, the Senate and the Assembly versions, are in the Assembly Appropriations Committee, where we are working to get them heard. It is something that is critically important to the charitable community, so we urge you, everybody on this call, to contact your legislators, members of the Appropriations Committee, Speaker Coughlin, to impress upon our legislature the need for this bill. It is an investment in the community. It's the amount that is foregone by the state is a fraction compared to what the bill would generate in donations. And as we know, this is desperately, desperately needed. So we are hoping that the Assembly Appropriations Committee will be able to take this up, but we need people to speak out in support of it. But again, I don't think it's possible to overstate enough just how critical the time we are in right now. Congress is debating new legislation as we speak. The landscape is changing every moment, literally hour by hour, and we can't afford to have them wait until after the election to take action. So contacting your member of Congress is absolutely important. Contacting your state legislators is also very important because we need our elected officials to continue to act and to prioritize the needs of the communities that nonprofits are serving and the ability of nonprofits to be there for them during this crisis and moving forward. I would like to thank everyone who has taken the time to join us today on this web briefing. I would like to thank you for your patience with the technology. I'm grateful to Maria Vizcarrondo, Karen Andrade-Mims, Anne-Marie Miller, Lorraine Goodman, Graciela, Leal, for sharing your insights with us today and as just a small sampling of what our community is facing. Thank you to members of the media for the important work that you're doing. Thanks to nonprofits in New Jersey and across the country for all of the work that you're doing in our communities to keep people safe, to keep them well, and to help them through what is an unprecedented crisis. Thank you to everyone for joining us. Thanks to our incredible team at the Center for Nonprofits. Stay well, stay safe, and we look forward to staying in touch.
Thank you.